Health tourism scandal revealed foreign mums r.ip-off NHS £16 million a year. At least 2,631 ineligible foreigners had their babies delivered on maternity wards last year, leaving the cash-strapped NHS out of pocket, figures reveal. In the past 12 months, cases have risen by more than a fifth from 2,167. But the actual figure could be much higher. The abuse comes despite NHS trusts now having a legal responsibility to recover charges from health tourists. Birth tourism is part of a wider scandal that sees tens of thousands of people arrive here for treatment from countries already receiving millions of pounds in UK foreign aid. It costs the NHS up to £2 billion a year. Alex Wild, from the Taxpayers Alliance, said, "Taxpayers cannot afford to run an international health service. New rules require hospitals to charge overseas visitors up front for non-urgent care. Staff have been told to routinely ask patients where they have lived in the past 6 months to identify who is entitled to free NHS treatment. The idea was to see whether checking identification reduces demand on services. Results are currently being evaluated. Just 84 English NHS trusts providing maternity care responded to a request for information about charging, around 2 in 3. The bill for the 2,631 ineligible women was £10 million. But the true figure could be closer to 4,500 women a year at a cost of £16 million. The largest single unpaid maternity bill in 2016-17 was at the Royal Berkshire NHS Trust, where a mother from Pakistan owes £46,000. Managers are trying to find 329 women to recoup care costs totaling £317,000. The biggest NHS trust, Barts in London, is tracing 438 mothers for a combined unpaid bill of £1.75 million. Other health tourism abuses include the treatment of cancer, infertility, HIV and renal failure. The NHS has quadrupled the cash recovered from health tourists since 2012-13 from £89 million to £358 million last year. Health Minister James O'Shaughnessy said, "Hospitals must make sure they charge people if they aren't eligible for free care. They are getting better at identifying those people." Last year the Daily Express revealed how a Nigerian mother named Priscilla, who received fertility treatment at home, arrived in the UK to have quadruplets and ran up an estimated £500,000 NHS bill. Nigeria received £230 million in UK foreign aid in 2016. Former cancer surgeon Miriam Thomas said, "The burden would ease if we could either charge the nation for the cost of treating these people out of its foreign aid gift or make the government change the rules." Mr. Thomas, now a private consultant surgeon at the Leicester Hospital, West London, has backed our Stop the Foreign Aid Madness crusade, which demands the government reallocate some of the £13.4 billion sent overseas to easing problems at home.